Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. Today we'll be going over 5 mental health NCLEX questions courtesy of nursing.com. Just want to make a quick announcement that if you decide to join nursing.com between August 16 and August 24th, you will be getting 40% off of their 2-year plan. And if you start a 2-year membership, they will send you a book bundle that is a total savings of about $300. And the books include 140 must-know meds, 63 must-know lab values, nursing mnemonics, and 2nd edition NCLEX review book. Please check out my affiliate link below if you would like to take advantage of this offer. A nurse is caring for a client who has dementia as a result of Alzheimer's disease. The provider writes an order for bilateral wristbands for restraints as needed. Which action of the nurse is most appropriate regarding this order? So I have worked in mental health, and restraints are normally reserved for as a last resort. If you know anything about restraints, they are definitely not PRN, like they're a last resort. So we would contact the provider about that order because that is not appropriate. Restraints should never be written as a PRN order. They are used as a last resort. And the way that restraints are applied is if there is a life-threatening situation or you fear that this patient could harm others, the nurse can initiate restraints and then has to call the provider within an hour to get that order. But you always want to find alternatives to restraints before applying them. And the nice thing about nursing.com is that they have videos, nursing care plans for dementia, and restraints 101 to kind of brush up on the rules and regulations for that. A 66-year-old client complains to the nurse that ever since retirement, the incidence of headaches, insomnia, and fatigue has increased. Which instructions would the nurse most likely give to help that would help this client to cope with this lifestyle change? So if you know anything about depression, you know that depression can cause anhedonia, which is like lack of pleasure, abolition, no motivation, inertia, which is lack of energy. What are some things that we can do before just putting them on antidepressants? So good self-care at home. So if this person is board, that you can teach them coping mechanisms to this client and how to take care of himself at home. The client can join support groups to talk to others, and that would give him a sense of community, a sense of purpose. And the client should avoid making other big changes for now. So retirement is a very big change, and if he makes another big change, it might overwhelm him. It might be a little bit too much, and he would not be able to cope with all these changes. The nurse is caring for a client with Alzheimer's disease. The client takes galantamine as a new medication. Which of the following elements of the client's history would alert the nurse to discuss with this provider? So a side effect of this medication is bronchoconstriction. So galantamine causes bronchoconstriction, so it should be avoided if possible in clients who have COPD, asthma, etc. The other listed contraindications are inaccurate. A hospice nurse is visiting a client in their home. When working in this role, the nurse knows to give care and support to whom? The client only, estranged families who are concerned for this client, the family only, obviously the client and the family. This one was fairly easy. It's not just the patient that's suffering, but it's also the family members as well. A nurse is working with the client to use biofeedback as a method of controlling anxiety. Which of the following outcomes would most likely result from correct use of this mechanism? Biofeedback is essentially the process of just becoming aware of your own physiological functions of your body. So for example, like trying to make your heart rate lower when you have a pulse ox on your finger. An ability to recognize and control the body's stress response, a resolution of the client's anxiety symptoms, the client being able to recognize that he suffers from anxiety. So that is the purpose of biofeedback, and it's becoming aware when you are stressed and being able to recognize your symptoms and stress and how to control these symptoms to achieve the focused state. That is all the questions for today. If you want a specific topic such as pharmacology, labs, prioritization, delegation, make sure you drop a comment below and I will do a video on that specific category. Thank you for watching. Make sure you like, subscribe. It helps me so much. You have no idea. Thank you.